Do you have issues with your neck and upper back? Does it feel like at the end of the day it's harder and harder for you to sit up straight and hold your shoulders back? Does it feel like at the end of the day that you shrunk and it just can't quite stand upright? Well, if so, I'm going to show you in this video how to release mid-back and neck pain using a simple tool at home of a foam roller. Now, this is a 6-inch by 35-inch foam roller. You can get these off of Amazon. They come in different shapes and colors and sizes. However, I do recommend the longer length because I'll show you in other videos how to use this for other body areas. So what we're going to focus on today is there is a muscle that runs from one vertebrae to the next, and what it does is it allows your body to rotate. And that covers up a joint called the facet joint, which a lot of times will become inflamed, and the capsule around it will swell, and that creates an achiness either right at your spine, or it can refer down a little bit down into the muscles. So the way that we're going to treat this is we're going to set our foam roller on the floor, and we're going to turn perpendicular to the foam roller, and you want to start the foam roller roughly about where the rib cage ends. You'll put your knees even with your feet pointing the same direction, support your neck, and then go ahead and arch your back over. Now some of you will feel those knuckle-like joints called the facets release when you do this movement, and it should feel relieving. But if you have any popping sensation, that should not be a problem for you. Just go ahead and lean over the foam roller, and you're going to gently roll up and down all the way to just to the top of the shoulder blades. You will not come down any lower than the bottom of the rib cage because that can create soreness in your lower back, so I do not recommend that. After you've arched your back and rolled through it a few times, you may find some trigger points or knots within the muscles that are tender. And if you do that, just kind of hang out there and breathe through them. And you'll feel them slowly dissipate, usually at about 6 or 8 seconds per. Once you have done that, then you're going to go ahead and support your torso. And what you're trying to do is pin one vertebrae and rotate the vertebrae below it. So from this position, you're going to take your knees, keep them together, and gently rotate to the side. You're not pressing, you're just letting the body weight take it to the side, and you should feel a really good stretch in the back and in the vertebrae. And you'll do it nice and slow like this, going each way, and then you'll move to another segment. And I like to start low, and I just kind of work my way up one segment at a time until I've released the whole back. Okay, so you should feel at the end of doing foam rolling that you should feel a nice release to your posture. You should be able to get your shoulders back and stand upright more. I do recommend that you can do this once per day. However, if you're finding that this is consistently a recurring issue, then I do recommend that you review your ergonomics, your exercise program, and if you get stuck and you need help, please feel free to call my office, and we're more than happy to try to help you with your back or shoulder pain. All right, any comments or questions, please leave them in the post below. Thanks.